Hello everyone, this is Prince and this is my presentation for this chapter. The article that I chose for this chapter is on low versus high dose dark chocolate and blood pressure in cardiovascular high risk patients. It was authored by Stefan Dersch and other co-authors, and it was published in the American Journal of Hypertension in 2010. So the purpose of this study was to determine if anti-hypertensive effects of flavanol-rich dark chocolate depend on the dose. That is, so flavanol-rich dark chocolates are chocolates that has undergone minimal processing to preserve its natural content. So these are chocolates with most of its natural content and less artificial ingredients. So the study explored whether consuming different doses of dark chocolate can lower blood pressure in cardiovascular high risk patients. So that was used, there were four of them. So the study design, which is the first we're going to talk about, they used the probe trial design. So the probe trial is a design where both the doctors and the patients go into the study knowing what kind of treatments they're going to get. So they used 102 patients with pre-hypertension or stage 1 hypertension and cardiovascular diseases or diabetes. So these participants, the 102 participants, they were randomly assigned to consume 6 grams per day or 25 grams per day of dark chocolate for 3 months. And the data that was collected was 24-hour ambulatory blood pressure. They took that before and after the treatment. So the type of analysis that was used in this article is a statistical the independent and the paired t-test. They also use the analysis of covariance. They reported the means, the standard deviation, and confidence interval. And there was a significance level of P to be less than 0.05 or 5%. So after the results or after the test, they got to know that both the low grams chocolate and the higher grams chocolate led to reduction in 24-hour blood pressure. So the 6 grams per day, the mean for that was negative 2.3 and negative 1.9 for the 25 grams or for those who consume the 25 grams per day. There were no significant differences between the two groups, but those who consumed the 25 grams per day of dark chocolate gained a slight weight of 0.8 kg. So dark chocolates may reduce blood pressure in cardiovascular high risk patients. That is dark chocolate that are flavanol rich. There were no clear dose response relationship, and the results supported potential blood pressure lowering effect, but it should be interpreted cautiously because there was no lack of control group, or there was a lack of control group. Control group is people who actually didn't consume the chocolate without the flavanol rich content. So what I learned from this article is that, like, I chose this article because I was curious about how an everyday food like dark chocolate could potentially impact blood pressure. I mean, people go to the gas station, the grocery store, and they'll just grab chocolate and eat it. So it seemed interesting to me to explore this study that connects something that everybody enjoys with a serious health outcome like diabetes and cardiovascular heart disease. What stood out most to me was that both the low and high doses of dark chocolate led to reduction in high blood pressure. Yet there was no difference, there was no meaningful difference between the two. And even though that stood out to me because I mean I got to know that it doesn't matter how much of the grams of flavanol rich chocolate grams that you eat, whether it was 6 or it was 25, you are still gonna get your blood pressure reduced. So thanks everyone for watching. I look forward to watching yours. Thanks.